É.
É bom aproveitar esse período para anos sabáticos para mais cultura, aprendizado.
Tem acontecido muita coisa. Eu mantive várias atividades também com o Brasil ao longo desse período, né? Tudo online e foi positivo. Então, estamos caminhando aí, estamos andando.
Bom.
E vocês vão fazer parte desse painel conosco? Ou...
Sim. Sim.
Legal.
Nós temos um pitch aí. A Fabi já é startupeira experiente. Eu sou early stage.
Eu sou startupeira experiente, mas não em inglês. Em inglês, no smartphone.
Você quer mais lá? Você vê porque lá eles são, cara, muito focado, né? É muito focado.
Poxa, mas vou ficar com cola, então. Pode ficar cola.
Pode falar em português, mas, por exemplo, eu acho que é um exercício aqui, não tem muito problema, né? Não. Mas o problema é que está aparecendo uma oportunidade aqui no Sebrae e tal, e aí o Sebrae já estava pedindo. O Sebrae, agora o pessoal que está indo para Londres, colocou até treino de pitch em inglês na programação.
E foi pago?
Hã?
Não,
não, você é selecionado, sendo selecionado. Hi, Gary. Nice to have you with us. Directly from Portugal. Your sound is not on yet.
Can you hear me now?
Yeah.
Yeah, makes sense. I've dialed in on my phone, but it should all be connected. But as long as you can hear me now, great to be here.
Yes, we can.
Excellent.
Olá, Bianca.
Oi, Fernando, tudo bem?
Bom.
Tudo bem. Oi, pessoal.
Como é que está a temperatura aí em Boston?
Maravilhosa.
É?
Tá um sol lindo ali fora.
Bom. Você está trabalhando presencial ou remoto?
Desde quando a pandemia começou, eu estou trabalhando remoto. Eu fui algumas vezes no escritório, mas só mesmo para algumas reuniões, mas muito pouco. Nesses últimos 2 anos, sei lá, nem 5 vezes.
Caramba!
É.
Você acha que a indústria farmacêutica esse vai ser o padrão?
Olha, eu tenho uma amiga, por exemplo, que trabalha numa outra que ela vai ser remoto, ela escolheu ser remoto para sempre. A Takeda, ela escolheu o método híbrido, para quem é de office base, né? E então a gente não tem dias assim exatos, nem horários exatos, é mais para ter face to face, conversas face to face, tudo, então reuniões, mas fora isso não pode realmente trabalhar remoto. Agora cada empresa eles tiveram pelo que eu entendi, todo mundo meio que foi para o lado de híbrido, pelo menos, para quem é de escritório, mas cada um teve uma política. Uns foram mais abertos para ser totalmente remoto e outros foram mais assim, querendo ver o que vai acontecer mais para frente.
Perfeito. Gary, está conseguindo nos escutar?
Eu?
Não, Gary.
Desculpa.
Sim, posso, mas você não é muito claro, mas Bianca foi muito, muito claro.
Perfeito.
Mas não vou falar em português, vou falar em inglês.
Oh, mas é ótimo o seu português.
Obrigado, muito obrigado. Melhorando devagar, mas muito obrigado.
Ah, é, né? Você morou no Brasil mais de 2 anos, não foi, Gary?
Pode repetir?
Você morou no Brasil mais de 2 anos?
Mais ou menos, acho metade nesse tempo. 1 ano no Brasil, 1 ano na fora, Chile, Inglaterra. Mas bastante tempo lá, sim, no Brasil.
Perfeito. Bom, so now we are starting our health tech network panel with some amazing health techs that will be presenting with us today. The startups that are going to be here are Brazilian startups, so and we want to be a little bit annoying, so we will do this panel in English, but we will be very patient. And I thank Marcelo Ramos for being the moderator today. Each startup will have 5 minutes and then 5 minutes Q&A, that so we can understand more about the solution. Bianco will be one of our participants in the Q&A. Gary Monk will also after do a presentation about his expertise. He's a digital health consultant with very interesting work. I'm very glad that he's here with us today. So Marcelo Ramos, you can have the show.
Hi, everyone. My name is Marcelo Ramos, and I'm very flattered and honored that Fernando gave me this mission, let's say, to be the moderator of the last panel. We had 5 sessions during the Health Innova Global Summit, and 39, including Fernando, we are achieving 40 speakers and a very good team. So I'd like to thank you and for this initiative, Fernando. From Health Innova Hub. And the panels, they worked and talked about some important aspects of the health market in general, international development of the Brazilian startups, how can they work internationally, the ecosystems, the global health techs and the tendencies, what's going on, the Latin American market. And now we are going to discuss a little bit about the North American, US, who knows abroad, what's going on in this market. Greetings for the people that are in person at São Paulo, and greetings also for the people who are attending us virtually. And we are, of course, not speaking in our mother language from, let's say, based on Brazil, which is Portuguese. We're speaking in English in here. And we are going to have, in total in this panel, 10 professionals or entrepreneurs from all over, and most of them are based in the US. But for instance, Gary is based on Portugal, and he has an English speech, some kind English accent. So I think he's from England. I'm not that sure, but I think he's from England. So, but as we can see, we have in here a kind of international panel, which is going to be very interesting for everyone who is attending us. And myself, I'm a dentist. I graduated quite a few time ago, and have specialization in pediatric dentistry. But at some point, I decided to go to the corporate market, making a post-graduation in management and marketing, and then making my settlement in this sector of this field of work, and working with dentistry, dental companies, medical companies, and also a little bit of pharmaceutical companies as a consultant. And now I'm developing a project with 2 other dentists as an entrepreneur regarding innovation, and with some events and some activities, trying to spread out this concept of innovation through the dental market in general. And also decided to go to academics again, and I'm making PhD and at USP São Paulo, and trying a partnership with a university here at Indiana, which is the state I'm living, And the focus of the research is teledentistry, which is a very, very strong tendency all over. And then I'm trying to get the pace and be in this boat also. So with no further ado, we have a very, very good and strong team of panelists in here. I'm just gonna follow the alphabetic order, not to get some kind of advantage for anyone. And we have Alex Manshane, CEO from HIHUB.TECH. We have also Bianca that is here, Bianca Bianco do Carmo. She's based in Boston, if I understood right. She works at Takeda and also global media information. He has this field of work. Fabiana Almeida, CEO and founder of Tech Balance. Gary Monk, based in Portugal, and he's an innovation consultant at Gary Monk Digital Consulting. Inácio Oliveira Ramos, founder of EasyCare, based on the US. Luis Otero, CEO of AB Startups. Marcelo Penacosta, co-founder of Well, based on the US. A lot of Brazilian names, but based in the US, which is very good. I'm very, very excited about that. And Raj Gathi Bandhi, I hope I spoke your name correctly, Raj, founder and director of Quantum Health, based in the US. And Silvia Scagliarini, CEO and founder of Vive Mais. So as Fernando said, we are going to have a 5-minute pitch for each one of you. Myself, Bianca, Gary, and Inácio, we are going to make the comments or moderate a little bit, and then we are going to kind of spread it out, free discussion about all the themes based on the aspects that just pointed out during our discussions. Let's make it as fun as possible. So please, Alex, you have your 5 minutes, and please go on.
Who?
Alex Manshane from HIHUB.TECH.
He's not here yet.
Okay. Can go for Fabiana Almeida?
Okay.
One moment.
All right.
First.
Yeah, I'm just following the alphabetic order in here. Once Bianca is one of the commentators, and Fabiana, you're the next on the line.
It's no problem for me.
Você pode fazer?
Yes, I can.
Yes.
I can do. Hello, everyone. I'm Fabiana.
Fala alto.
I can say.
Okay.
Hello, everyone. I'm Fabiana. I'm founder of Tech Balance, and today I will talk with Tech Balance. We balance people and business with technology. Already impact more than 12,000 lives with plant production and resale generation. The problem that we solve is sedentary lifestyle that is cause of more than 5 million of deaths every year, aging with diseases, including falls. The third leading cause of death among Brazilian elderly, with the cost of $30 per fall, $30,000 per fall in the United States. Our solution is prevention. We make preventive risk assessment of falls and injuries for preventive diagnosis and monitoring. With TechSafe, we evaluate elderly and frail patients with tech support. We attend from sedentary to athletes. With Tech Online, we do customizable screening for entire population, and on our platform, the managers and health professionals can track the evolution in graphs and data analytics. Our patented technology measure the oscillation of center body mass with in a 10-minute test, physical test, that generates a risk score and a PDF report with a treatment plan. Our direct market nowadays is $800 million. This is our Brazilian market target, and our commercial value proposition is about resale and saving. We sell lives per year with a monthly payment and a discount as the number of lives increases. Our direct competitors are outside from Brazil, and our difference is our important market in Brazil and our product as a platform. Our indirect competitors, I think, the technology are complementary from tech balance, and we see that they are building highly capitalized. Our product timeline nowadays, we train the staff, our customers to use our software, and now we are launching a new version, a B2 version, that we are available in Google Store with a remote self-assessment. And in the near future, we are available in smartwatches too. Nowadays, we have more than 12,000 active lives, more than 50 B2B customers, and we already had proven our 25% of saving in Imagine Preto and 30% of ROI at our today fleet. Our board member investors are Paula from Boticário, Dr. Vidal from NASA, Guilherme Rabelo from Incor, Dr. José from HIHUB.TECH, Marcelo Louritzin from HIHUB.TECH. I have more than 16 years of experience in management at health marketing. Elton has already sold his own IT business. He is developed full stack, and Paula is an experienced retail entrepreneur that helps us with financial and strategy. Nowadays, we make 70,000 reais a month. We burn 50,000 reais a month, and we have 250,000 as a reserve. But we need to launch our second version. Because of this, we are looking for a new investment, 1 million per 12% of the company to develop market and internationalization. Thank you.
Thank you. Thank you very much. Marcelo, with you.
Yeah, fantastic. First of all, fantastic, Fabiana. And I'll just give the word to Bianca, Gary, and I don't know if Ignacio is with us, but Bianca and Gary, you can go on, guys, and then I would just try to wrap it up.
And just a minute, welcome, Marcelo Costa. Great to have you with us.
So, Bianca and Gary, if you could make some comments, it's with you.
Oh, first of all, congratulations, Fabiana. The presentation was great. For me, at least, was breaking up a little, so sometimes it was hard for me to understand little things, but I think I was able to gather most of it. But again, you did very well. I don't have like a specific comment other than saying that I think you guys are doing great. But I have a question. When it comes to coming to, you know, being trying to go abroad and get other markets, what is the plan? Let's say if you want to break into United States market, what is the plan? Do you have anything in mind, or it's still in the works?
Nowadays, we have our patent here in the United States too, and we are with the plan about our second version. It's more scalable with download in your app, in your cell phone, and self assessment, your movement, and take your outcome result or PDF result about your situation. And I think our plan is dealing with health insurance, and like I need help with my English. Posso falar em português? Pode. My English is not enough for all things. Bom, acho que nosso plano é trabalhar com a segunda versão, mais escalável, trabalhar com vidas em seguros de saúde, para avaliação do potencial do seguro de saúde de cada indivíduo. Então, vender vidas, escalar com mais vidas e vender diretamente para o B2B. Nós temos hoje uma unidade de representação já em Portugal, e também estamos captando em Portugal, mas também pensando já em outros, e estão falando, né, com outros investidores fora do Brasil, e o começo vai ser unidades implantadas em Portugal, depois, né, possivelmente na Espanha, e em breve ter realmente a solução com uma biblioteca automática de tradução para poder, então, fazer o download da avaliação em qualquer língua.
Obrigada. Do you want me to ask in English or in Portuguese? Doesn't matter.
You can in English. Prefer
Okay, all right. No, thank you, Fabiana. You are doing great. When you start speaking in English, I understood everything, and that's pretty much what you said in Portuguese again. So again, congratulations. I was just wondering, because when you mentioned during your presentation that some markets you have direct competitors and some you have indirect competitors, maybe United States is not your focus right now. I was just wondering if you know any competitors here in the US. Are you aware of any competitors here in the US that would make it harder for you to come over here? Also, when it comes to health insurance, it's different. The system here is different from the one in Brazil too. So that's something to keep in mind. So are you aware of any competitors here?
Eu não conheço competidores diretos da Tech Balance nos Estados Unidos. Os principais competidores são da Europa, porque a Europa é muito forte na análise de movimento e esse tipo de Deep Tech. Mas, assim, nesse modelo laudo, exame, monitoramento do risco motor e de lesões e quedas, não conheço nenhum competidor direto nos Estados Unidos.
That's interesting, because maybe you're going to be the first one. I'm not aware either, so.
I need my English for this. Because of
that's why we are here.
Because of this, I am here.
As a researcher.
Okay, thank you very much. That's all for me. Thank you.
Okay, Marcelo. Oh, Ashi, do you want? You can go.
This is Courtney. I have a question. So since you mentioned about some issue with insurance, I wonder what are the issues are. Is it similar that we face in United States or something different? Because overall, these insurance has same mindset when it comes to startup, when it comes to technology, when it comes to like digital health. So I want to see what's the difference.
Oh, thank you. I think I need to open my mind and open my English for this, but I am now trying to talk in English for this, and I need to be more comfortable for this.
Eu respondi a pergunta?
Qual foi a pergunta, Marcelo? What was the question?
Haj, can you repeat your question again, please, for the audience?
Yeah, sure. So my question is, what are the difficulty that your startup is facing with insurance? I want to see if it's different compared to US.
Qual que é a diferença? Qual que é a dificuldade que você está tendo com o seguro?
Com as seguradoras, né? Com as operadoras de plano de saúde.
Okay. Tempo de aquisição do cliente. O Brasil é um país muito regulado, com um mercado de saúde muito fechado, e ter uma entrada é um dealing. Nós temos um bom resultado para a nossa situação. A gente tem baixo rendimento, que é uma equipe muito enxuta, mas, de fato, é um desafio, porque eu entendo que o mercado de saúde não tem claro o que ele precisa para tomar a decisão. Então, ele faz um mapeamento de todas as possibilidades e mantém esse mapeamento no rollout, assim, fica entendendo que quem faz melhor, o que faz melhor e o que eu preciso. Então, também é uma dificuldade ser o primeiro, porque depois que entra o primeiro, também é difícil e tem tempo para a janela do segundo.
I think the time here for me to gain a corporate client, especially in the health insurance place, is very long. I don't know if this is the case in the US, but here it can might say maybe
Yes,
over 6 months to close a corporate client.
Yes.
So this is it's a big funnel. Marcelo, next one.
Yeah, and now Gary, please, if you want to make some comments.
I think Gary has a presentation, or he has some remarks. I think Gary, you can make your remarks regarding health.
Yeah, I just dropped your message, Fernando, but I just want to say, the presentation was really clear. I think, the only thing was some sort of sound issues. I'm not sure I grabbed any of, some little bits of it, but I think I got most of it. And then I think some of my other questions, one came up already about expansion into the US markets. But I think I'll be interested to your response to some of the things that come up in the presentation, and if I'm on the mark or not with some of the themes, because I'll cover some US themes, but also some of my feelings about Brazil from a gringo's perspective. So I think that might fuel some of the discussion. But yeah, well done.
Okay.
Yep. And regarding myself, some final comments. I just figured out that you have a board, and it's a very, very interesting board. And it's difficult to work with boards because they are close to you, they make comments, they make suggestions, or they even interfere in your business. And you, as I saw, you have a very good team in your board, which is good for your company. It's a pressure, yes, but at the same time makes you grow and makes face the challenges and develop yourself. So I think it's very good. Understanding the US market, it's something very, very interesting because there's a lot of partners working together at the same time. The providers are very spread out, and they are tertiarized, quartirized, at a lot of levels of partnerships and interferences at the same time. So let's say in a hospital, we have 3, 4, 5, 7 different companies working towards the patient. So it's important to understand the market and the profile of how the game is played, so to say, in each country, not only about regulation, but about the market itself. So it's an invitation for you to let's say, make a visit or to understand a little more, because you have a very good potential product, because if you reach out the market in terms of offering something to lower costs because of the prevention approach, it's good news for the market. But at the same time, you have to know how to approach them. So it's just a suggestion, invitation, okay? So the other person in here,
Marcelo, I think Gary has to be next because he will have to leave early.
Yeah, the next in here, it's Gary Mack, please.
Okay, appreciate that flexibility. Didn't want to push in, but hopefully some of the points will be useful as well to fuel the discussion. Just checking you can see my screen okay?
Yep.
Great, I think that's a yes. So I think I've just got I'm going to try and keep it to 5 minutes. Feel free to cut in if needed. I want to talk about just investment, throw some ideas out there, give the perspective on Brazil. Again, it's from my gringo perspective, sort of from my background very briefly. I was in the US for 5 years, came to visit Carnival for a week in 2020, ended up staying for 6 months, not just because Carnival was so good, but also the pandemic had something to do with it. So spent probably the last 2.5 years, half of that time in Brazil. So I've got a bit of an idea, but I'm probably still clueless in many ways. And then I'll talk a little bit about some of the opportunities of partnering with pharma and digital therapeutics. I don't know if some of you will have seen this version of this slide from Rock Health tracking, and this is US funding of HealthTechs within the United States. You may have seen certain versions, but this is the latest version up until Q1 of this year. Essentially, things have been going, if you like, exponential in terms of funding within the US for HealthTechs. You can see the really big jump in 2021. What I would say is, as a word of caution, before I get too enthusiastic, is that this is only for Q1 in 2022, but actually the deals are quite low. I say quite low, about 10% lower than they were the same time in 2021, so this year. And the actual deal size is less than it was, although there is slightly more deals done this year versus last year. So anyway, long story short, it's too early to say, but funding may be slowing down, so exponential growth, but let's wait and see what happens this year. A comment I made, and I've referenced this, but in terms of funding in Brazil, I could see that last year there was about $500 million funding across 69 deals. Obviously, it's going to be quite a bit lower than the US. I did a bit of a rough calculation with the GDP, though, and it seems like even when you take that into account, it's not a perfect measure. But for me, it feels like the Brazil market is underfunded when it comes to health tech. I'd love to hear some sort of challenge back, but it really feels like there's probably not enough investment going into health tech in Brazil. Again, that's from an outside gringo perspective, but it just seems like there's so much more potential. Whether that money comes from more places in Brazil or externally, I guess that's foreign investment. Those are both options. I wanted to come to, again, my sort of understanding from speaking to people about why founders in Brazil, from my experience, don't seek foreign funding and market expansion. And some of them are quite valid, I think. Often founders can get enough funding within Brazil. VCs themselves don't always understand the Brazil market, the opportunities there, perceived risks there. And then I've spoken to so many founders, without exception, have really good English, but don't always have confidence in speaking to VCs. So, that may be a reason in terms of the funding side. And in terms of the actual market expansion, I think this is really nice. It's the fact, a lot of passionate founders I meet, really want to make an impact and change the healthcare system in Brazil, which I get. And then Brazil the 8th biggest market in the world is a big, potentially big enough opportunity. And I think Marcelo might have covered this as well. This list isn't exhaustive, but there's so many differences. In the US, I've listed 5 here, but there's probably 20 differences as well. So big opportunity, but obviously some challenges navigating new markets. And I just threw some potential benefits, which should be obvious, but again, getting access to investors, with a global perspective. There may be more funding opportunities there as well. And even if you don't want to expand abroad, if you've got a solution, maybe there's an opportunity to partner or license that out, without going sort of full time into the US or other markets. Happy to take questions at the end or throughout. I've just got a couple more slides left. I don't want to spend too long on a couple of them. I'll share them with you. They might be of interest. Quick message on this, global stats, but there's so many digital health apps out there. I get the question is, are they offering real value? And we're seeing a smaller number that end up actually being clinical solutions globally. I'm guessing I might be wrong. This is a total guess, that it's probably similar in Brazil. You've probably got a lot of different health apps, and there's probably a small number that actually are used, but feel free to correct me. And again, this is a slide I'm just sort of pivoting into, but I track globally what major pharma companies do in terms of partnering with HealthTechs. So a quick summary, you can see a number of companies like Roche, partner with these, quite a number of different companies. Same with Bayer through their incubator. So there's a lot of partnering from pharma to multiple different health techs. Happy to share the slides after. I do share these on LinkedIn as well. But top line summary, a lot of activity and opportunities within pharma globally to partner. If that's something you want to do, you might not be interested in that. I'm sure there's probably opportunities within Brazil. And I think I might put that slide in the wrong place, but I will stop in a minute. But just to say, digital therapeutics are a big opportunity. So it'll be interesting if the discussion goes there. Main focus tends to be in neurology and psychiatry. And then I released this on LinkedIn today as an update, but it shows, again, quite pharma-centric, but the relationships between pharma companies and tech companies specific to digital therapeutics. And again, lots of sort of relationships where individual tech companies are partnering with multiple pharma companies, lots of different disease areas, but again, the focus on neurology and psychiatry with some in cardiovascular. So, I'll pause there on that because there may or may not be interest, but happy to pick that up in discussion around the potentials to partner with pharma companies. So I think in the wrong place, that was it. But happy if anyone's got any questions, or we can sort of continue the discussion as we go through the individual pitches.
Very enriching, Gary, and it's a shame that you shrink it in 5 minutes. You could make a lecture of hours probably, and that should be very nice for us now that you understand a little more. One thing that we are facing in Brazil, mainly in hospitals and this specific healthcare service market, is acquisitions and the kind of concentration. Do you see the same pattern in other countries? Let's say Portugal, England, US. Are you facing or observing the same pattern or not?
Yeah, so you're talking about the concentration of what available physicians and then equating into time that they would have then to spend time with patients. Yeah, definitely. I mean, I've got Portugal's quite new to me, but certainly experience with the UK market, definitely, especially probably in both general practice and specialty care, actually, very limited time with patients. Probably common everywhere, even in Brazil, but that's really important, certainly in the UK and the US, to fit any solution into the clinician's workflow. Because, I've seen in the UK, even if it's a slight bit of incremental time to the physician's workload or the nurse's workload within the UK, and I'd add the US into that as well, with administration and burnout and being stretched. That's probably one of the most important factors, is fitting any solution in and making it, definitely not using any more of the physician or nurse's time, but ideally saving them time, you know, in an obvious way. So I don't know if that kind of answered your question, but that's kind of the biggest issue I see related to that.
Yeah. Anyone should like to make some comment? I have another question, but I would like to open up the mic for other ones if it's the case.
I have a quick question regarding these pharma partnerships with those digital therapeutic companies. Just out of curiosity, are you aware of any companies, those like startups, come from LATAM, like being Brazil or any South America countries?
Yeah, it's a good question. I did sort of preempt it. I had a look, but I can't promise that I've got it 100% accurate. But I didn't see any. I would say this caveat is more that it's around sort of global partnerships. So I would have included a company from Brazil if it had been a global pharma, but there may certainly be examples of, you know, HealthTech in Brazil partnering with local pharmaceutical companies within Brazil. So I wouldn't necessarily map them on there. But in terms of those global partnerships, I didn't find any. If there are any, I'd love to hear about them. Not saying they don't exist, but it seems they don't seem to be coming from LATAM particularly. And if they are, it's a very, I'd say, minority.
I see. Oh, sorry, go ahead.
No, Europharma was here earlier today, and they now their Open Innovation Program is looking for startups in Latam. So you start to see this movement where they are looking for startups all over Latin America, as well as other pharmaceutical companies that are starting to scout Latin America. And I think this is a trend for the future in order for corporate venture in the pharma space to be stronger regionally in Latin and Brazil.
Yeah, I believe it.
So I have to ask about the innovation collaboration with pharmaceutical company. I am working, my company is working in that area. In terms of selections, right? So the pharma companies and the selection of this technology partner is with double lens. They have to go through FDA approved because of the data that been stored, right? You're creating the decentralized clinical trial. It's a newbie in pharmaceutical companies, but to create the whole ecosystem, you need to have level of security, and that need to be addressed, and that need to be kept in US. So that is the critical decision for these pharmaceutical. I work with BI, Boehringer Ingelheim, I'm working with another company. The data need to be stored in US itself. It's in the US ground. So that's these companies are looking for. But huge opportunity. I think they're definitely looking for more robust technology to partner, and they always exploring this partnership. Yeah.
Yeah, and Rajni, I'd say, yeah, definitely in terms of the legal requirements, there's some quite strict requirements there that companies have to go through. You know, and there are certainly, and there are a lot of US companies, maybe it is easier for them, I don't know, health tech companies, but quite a few international ones as well from Europe, even from, you know, Iceland, I think Sidekick Health. So there's quite a few in Europe still make that jump, and a few in Asia. Asia's probably fairly low, but there's quite a few examples that come from Asia as well. So there is some regional activity, but probably most is US-centric, which may or may not be to do with the regulations that you mentioned and finding an easier understanding of that market.
But huge opportunity. Someone need to try. Yeah.
Big. Yeah, agree. Totally.
Thank you, Gary. Thanks so much for being.
I'd like to make a final question. Is that possible?
Yeah. Please.
All right. Do you think those companies, they're looking for, let's say, young partners or startups inside their headquarters, which mean they're incubating and developing those companies inside, or they are looking at those open innovation hubs in some kind of spread it out, looking at the market, or they are creating their own let's say, partners from their own perspectives? They're looking inside or outside?
Yeah, it's a great point. Mainly, to answer your question sort of broadly, it's mainly looking outside, but some companies have built stuff inside. I think AstraZeneca built the Amaze platform. They may have used a technology partner, but they built that essentially in-house, and I think they sold that recently. I'm trying to remember who to, but to an external company. But that's probably the exception. It more tends to be partnering, but that could also involve looking to potentially buy startups, but most of it is around the partnering that we see at this stage and looking for what's out there. But within that, there's also the sort of, if you like, Bayer used the model of the incubation, where they actually, develop startups and incubate them early, whereas other companies will go out and look for, if you like, more fully fledged or developed startups. So yeah, in summary, there's kind of a range of models, but the one I see most of is partnering with existing companies, is sort of leading the way.
Which is great news for our startups in here today, because they can go for our Open Innovation Program in Miami, Toronto, LA, or whatever, and then they have a chance to let's say, show off and then have a, who knows, will be grabbed from one of those companies. So it's good news. Thank you.
Great. Thank you all.
Thank you.
So Fernando, the next one, what are
Marcelo Penacosta, can you present well for us?
Hey, everyone. Yeah, for sure. Yeah. Let me share my screen here with you guys. Fernando, I'm having trouble here, like sharing my screen. I'll have to go off and on again. So
okay.
give me 10 seconds. Maybe I'll go next after the next person.
Silvia, can you go?
Yes.
Okay.
I try.
You try. You succeed.
Vai sentar aqui. Vamos sentar? Quer sentar aqui? Entendeu?
Right. Seems that I'm fine now. Should I, Fernando, should I go and move on?
You can go.
I'm sorry, I didn't get that.
You can go, Marcelo.
Okay, cool.
Okay.
All right. So Well is well, first of all, let me introduce myself. I'm the CEO of Well, which is a preventive and personalized healthcare health tech based in Brazil. So I'm going to start with talking about Mauro. Mauro is, I mean, it's a real person. Obviously, we changed the name of him. He's 39 years old. He lives in Brasilia, and having a quick glimpse in his life, like he's sedentary. His diet is not that great. He loves ordering from my food, like fast food. He's already have some like biomarkers like out of the normal levels. Has a family history of diabetes, and had a few problems, like a few acute problems, and doctors doesn't seem to find the root cause of them. He the interesting thing about Mauro in his like health journey is that he tried to subscribe to Clivo. For those who don't know, Clivo is like a very interesting health tech in Brazil, so that take care of like chronic patients. But he wasn't accepted. He wasn't eligible to be part of Clivo. So basically, he finds himself in a kind of interesting situation where he has like a poor lifestyle routine, and seems to be kind of already paying the price of his like lifestyle choices, right? So this is Mauro. Going on a sort of a higher level, the main thing I wanna see here at this point is like that a lot of the majority of the chronic diseases we have, not only in Brazil but everywhere, they are driven by bad lifestyle choices, you know, bad lifestyle habits. On top of that, you know, we have a very clear indicators that, you know, in Brazil at least, that we have a good portion of the population is like sedentary and is getting overweight more and more. On the sort of on the corporate side, you know, we have a very acute problem in terms of like absenteeism, you know, like medical inflation, and like you know, we have an aging population, right? So that's all the elements there for the perfect storm, like in the next years, you know, for not only in Brazil but a lot of countries as well. So this is our solution for the problem. So Well is a tech-enabled like health company focused on prevention and personalized medicine. So basically, we have an app, and we connect users and health coaches, focus on habit changes, like small habit changes towards like a healthier lifestyle, right? And why are we doing this now? So basically, I guess the pandemic triggered a lot of different behaviors, right? So maybe if you're talking like 4 years ago, preventive care and even telemedicine in Brazil wasn't at where we are at the moment, you know. So this like elements, you know, in the paradigm shift that we see in healthcare, going from a you know, going towards a preventive care direction, is a sort of where we want to be. So just a quick example here. Speaking of Oscar, obviously they're in a different sort of different sector. You know, they're HIHUB.TECH, a big one here in the US. Back in 2012, you know, when Oscar was founded, this is like a Google Trends, like a graph, a chart, and basically the word wasn't even out there, you know. So what we're doing now at Well, in a sort of a similar way, we want to be well positioned for when when preventive care and you know, lifestyle medicine becomes like a trend, becomes like a mainstream thing. We want to be well positioned to be the leaders in that kind of a health and wellness intersection. So here's like what we've done so far. So we started like an MVP last year, from August up to February this year. Had a lot of really amazing results with our cohort. Not only with engagement, which seemed to be high for the type of work we're doing. NPS was great, but above all, like we had amazing testimonials of the impact we were causing on people's lives. You know, again, proving the concept that small changes across time will kind of lead to a sustainable and kind of impactful health change. Yeah, so just a little bit more about like here, like I like to say, for example, the example of this client of ours, this patient of ours, she had symptoms of like anxiety, overweight, and basically we suggested her to start like with yoga, but she just never thought about that before, so our team kind of nudged her, hey, why don't you just like start with a 10-minute work yoga you can do like in your desk. To our surprise, the patient got so much engaged with the practice, that she kind of became a yogi, like, and she's now like doing following the practice for more than like 4 weeks now, and we already started measuring like a positive outcome on the symptoms that she brought to us in the first place. So the next steps for us, how do we build, how to turn like this this business into a first a hyper growth business that will impact a lot of millions of people. So we have like three main areas that we want to focus on our V2 that we're just building. So one is connection. We're focusing on four main aspects of care. So one is like weight control, weight management, stress management, sleep improvement, and age, the control of age, age well. So on top of that, we have a very strong connection with the Grupo Saving, with the leader, like a main relevant player in the Brazilian sort of health market. So we're going to use them like for distribution and kind of for relationship with stakeholders and all that. Also, we are highly connected with the scientific community in Brazil and in the US. Our advisors like help us like design the protocols, and help us like publish like a few studies that we plan to do in the next couple of months. And on the sort of experiences side, we are absolutely focused on providing and building a amazing experience for the clients. So we're now building like a native app where AI will play a key role in kind of enhancing the experience for users and delivering like health insights for not only the end user but also for the team. So this is how we make money. So basically, we charge we have two types of like programs. One is like a live program, 6 months program with like sessions with health mentors, and we have like an unlimited chat with the team. And basically, the way it works is like we have you can choose like a health mentor to help you like on your journey. And around the health mentor, we have like a multidisciplinary team of physicians, dietitians, and personal trainers that will assist the health mentor with the ongoing health journey of our clients. And we also have this other offering here, which is the chat only plan. So basically, it's we don't have it's more focused on the educational side. We don't have the live sessions with mentors, but we also can provide a level of like personalization as almost as good as this one here, but for a much lower cost. So basically, the live program is about like generating fans and word of mouth, and the chat only plan is about like acquisition and scale. So looking ahead, this first year of operation, we want to have around like 8,000 users. That's our goal for end of this year, and then like after that, we plan to grow like in a very accelerated path. Up to end of year 5, our plan is to reach like more than 1 million users. So yeah, that's all. I could try to keep short and sweet for you guys. Thank you so much.
Thank you, Marcelo.
Yeah, if you have any questions, like love to.
All right, Marcelo, meu xará. So
Xará.
Nice to meet you. Yeah, and I was just waiting for the final screens and final slides to understand a little bit about pricing, because working with this kind of very customized market, it's always a very, very high challenge in order to make this balance between offer something complex, but at the same time offering price. And with this chat plan, I think it's reasonable, which means it's affordable for most of the population. Are you thinking about making this development true in Brazil? Which one of the kind of customers, those that let's say everyone in terms of pricing, or do you have a kind of space or a kind of a layer of clients do you want to reach out?
Yes, we do have a very specific like target for our go-to-market. So basically, I'll probably describe the persona. I mean, it's going to be easier for you guys to kind of grasp our target. So it's basically like a person like who works in a sort of a mid to kind of a big corporation, let's say in São Paulo, and she is probably in her early 40s, and basically she has a very basic like health insurance, which is fine for like secondary and tertiary care, like hospital-wise. She has a decent sort of a coverage, but it's very poor in terms of the sort of a primary and kind of a preventive medicine care, So with that price point in mind, we're targeting like let's say a sort of a B/C consumer,
Thank you. Anyone? Any other comments or questions?
Yeah, I got a question. It was great, Marcelo. I think from what I understood, it would be self-paid, and I think maybe covering those people that weren't eligible for things that might be covered, apps that might be covered by their sort of private health insurance, if I understood it. It's a bit of a naive question from my side probably, but is this something that could be reimbursed by the state or SUS or something? Would there be an argument there? Because obviously I can imagine there'd be real value to patients.
Yes, I mean, that's a great question. Thank you. I mean, it's definitely, it's not on our radar at some point to connect with like policymakers in terms of like making this a much bigger idea accessible to the broader population. So yes, it's not our focus at the moment. We're trying to be, a bit more niched, if I can say that. Yeah. But at some point, yes. So yeah.
Right. Okay. Thank you.
Thanks.
Marcelo, thank you. I have a question regarding the business itself. I mean, how the way it works in terms of health coaches, and my understanding is they don't have a medical or scientific degree, right? They are just like people that are trained. Am I correct? Am I going to the right direction?
Oh, yes and no.
Okay, all right.
Basically, that could be a choice. So we kind of, in our case, we chose to have health professionals like physicians, dietitians, nurses, or psychologists with a health coaching certification.
So okay. So, but like when I have let's say I'm a customer, I have a plan, the 145 reais per month. And yes. I'm gonna have someone assigned to me, right? Like, or I'm gonna have a multiple, like a group that I'm going to be able to reach out to. How does that work?
On the onboarding process, the very second thing you're gonna do is you're gonna have like a menu of health coaches, right? So that will kind of, it's almost like a matchmaking that we'll do after you kind of answer a few questions. Like we're gonna know who you are and what you want, and then you're gonna match with the right. I mean, I'm gonna give you like 3 options for health coaches, and then you're gonna choose that, essentially. So that's gonna be your health coach. Obviously, you can change along the way, but the ideally is that you don't change, and we understand who you are and your necessities, your needs, and go from there.
Marcelo, I have a question.
Go ahead, Fernando.
Oh, thank you. Do you, in the near future, do you see well as a digital health therapeutics in the sense that you are going to report for the public in general what are the average results that well is getting with its clients? What is the impact of a company incorporating well to its benefits? How do you see reporting those results?
Yeah, that's a great question. So basically, we use like the very basis of our evidence-based approach is like value-based like healthcare, right? So we use like validated questionnaires where we're able to measure the outcome. So basically, we're able to measure the outcome after a 6-month period of time with a very specific parameters. Again, to a point that will kind of prove improvement, along those 6 months. So again, it's everything you do is based on the HIHUB, the VBHC international protocols. So with that, we're able to measure with accepted scientific protocols, if that answers your question.
Thank you. Thank you.
Thank you, Marcelo, so much. Thank you, Xará. Anyone else? Some kind of...
I think we have now to go to Sylvia because of the time.
Yep.
Okay.
Hello, everyone. I'm Sylvia, founder and CEO of the startup HIHUB.TECH. I'd like to thank you for giving me the opportunity of talking about my startup for you. First of all, I'd like to apologize for my English. This is my mother, Elena. She's 19 years old, and my inspiration for creating a business focus on the future on longevity. Have you realized that the concept of aging has changed? Have you ever thought about what role you play for family as each generation grow old? Here's some data on longevity marketing size in Brazil. In 2050, we will get to 6 million elderly in Brazil. 85% of those are eligible direct customer for HIHUB.TECH. So some of challenges elderly people generally have as they grow older are to living on residence, to maintain their autonomy and independence, to deal with lack of social interaction, to find qualified professional. So see, you can make the leads of health more interesting. HIHUB.TECH is a startup in segment aging place and HealthTech. He offers services of health, physical and mental well-being and activity for longevity. Your core values are aligned with the old World Health Organization principles. The principle number 3, good health and well-being. The principle number 4, quality education, and the principle number 8, decent work and economic growth. Our solutions are supporting the care of the elder family member, service of health and well-being for active longevity, qualifications of mature professional. Fernando? Oh, sorry. Okay. The technology is the key. You are a technology-enabled care company. The technology developed is HIHUB.TECH one and includes the entire connection process between professionals and customers for home and external care and the telemedicine online connection part. HIHUB.TECH has an app which allows customers to find the most suitable caregiver to the needs. These are some of activities that HIHUB.TECH provides to customers. Activities at home, outside activities online to playful games, computing, coach, yoga, and other activities. They also provide online appointments. The app has a proper telemedicine platform for fast interaction between the elder and the professionals. The same app has a backend developed for the caregiver. The social caregivers are over 45 years old with upper secondary education, active in several fields education. So, please. All caregivers that are approved in your recruitment process go through a course in gerontology. The business model is marketplace intermediation, and we offer a new benefits for companies. That's an option we have made available for companies and customers in order to provide customized services. For example, a company may purchase a voucher to give to their clients or employees that would allow these people to benefit from the service according to their needs. The business model minimize B2B2C, marketplace intermediation. Companies acquire minimize credits and make voucher available to customer and employees. 70% the amount received is payment to the caregiver. 30% of received amount is withheld by minimize. Average ticket 150 reais per hour. These are some of the indirect competitors for minimize. Most of them are focused on home care. It is not the case for us. The timeline to minimize, we start in 2019 with the government, with São Paulo, encourage the social program, Juntando Pontas. And 2021, the brand Minimize was born. Minimize incubated at Albert Einstein Hospital and the Alex Bill Startup Program. Throughout the year, we are between first place in many different accelerations process. Now, in 2022, we are rolling out a pilot project with Ashe Pharmaceuticals, and in the second half of the year, we will be working another project with Unimed Guarulhos. There are some actual clients and future clients, Ashe, Unimed, Albert Einstein, Pfizer. This is the result of the project Juntando Pontas, the 19 and 20. So in 2021, we had achieved 400 appointments, and we expect to achieve more than 50,000 appointments in 2022. So this is my profile, and the team. The next piece, the leader team, the Minimize, they have a team very, very short. And this is the TV social caregiver. Have many social caregiver in the platform. So for fine. There is only one secret to live longer and better. Believe in yourself and make sure your time is now. Thank you so much.
Thank you so much, Sylvia. And it's always touching when we see a project like this with so humanized approach. So it's fantastic. And I'll just open I'll give space for the other speakers, please.
Great. Thank you. Yeah, very, very, very touching. I could see a lot of value in there, you know, from a human perspective. And I don't know whether it's part of the business model. I think your business model makes sense. In terms of getting the evidence for it'll benefit the patients in terms of quality of life, but it's also in terms of the costs. Like if you can obviously keep patients from having more independent, it's going to reduce the cost of having a carers, or also reduce the time that their family has to need to, you know, take time off work to care for them. So is that evidence that you'd be looking to gather as part of this? Because I could see a play there, really, that evidence to really be a strong, you know, strong way of getting more, if you like, funding from health insurance, government, private individuals.
Não ficou claro, o áudio aqui ficou pouco cortado, Marcelo, assim. Can you repeat? Did you make? Was that a remark? Did you have a question, Gary?
Yeah, sorry if it didn't come out clearly at the end. It was, do you plan to capture the evidence on the outcomes of the app? So if it prevents people needing more care in the future.
Se você tem como ver os desfechos desse apoio, se melhora.
Yes. I have the dashboard in the platform, and I talk with the customer about the after the appointment. I have the team for the call center for have the talk about the customer after all the appointments. And now I see the upgrade for the customer for the experience with the attendment for mid-mice. You understand? It's clear? Okay.
Okay, thank you.
Well, great. Anyone else? All right. So we have now HIHUB.TECH. I hope again I'm speaking your name correctly. And she's the founder and director of the Quantum Health based in the US. It's yours.
Can you hear me, guys? Thank you so much for giving me this opportunity. Yes, I'm a female physician turned entrepreneur. I started my company almost 6 years back when telemedicine, telehealth, anything to do with digital health was science-fi movie for most of them. But here we are now. I wouldn't say thanks to COVID, but I think COVID definitely cornered the healthcare profession in US to leverage technology, to adapt technology. That's us. We trying to make our life maintaining a high, I would say high maintenance life with super busy and trying to make everyone happy. From there, we went to here, deal with a lot of technology at the same given time. I remember 2020 was a year where we were cornered to use technology, telemedicine, and just see patients remotely. That was the thing. And people panicked and they tried to use whatever technology they were. That was the deal 2020, I would say. Then the telemedicine and status quo is we got too comfortable now, I would say. Telemedicine and patient, definitely, that was another thing in our US healthcare where patients were reluctant in a way that, oh, so I'm not gonna meet my doctor? No, you're going to meet doctor, but yeah, you have to, you have opportunity to get out. Well, you can take the treatment from sitting at home or sitting in a parking lot, right? If you're working, you at office, you can't get out or you travel this, but sometimes the patients get too excited, as you see in the slide. In my company with telemedicine in mental health, we leveraging technology big time where we proving more of the data-driven mental health service providing company. It's not just one thing. So when we started to talk about telemedicine, everyone talk about, okay, telemedicine is the only component. That's absolutely wrong. It's only component, it's only media where you can see patient, but there are so many components is missing. You missing the patient portal, you missing the seamless integration of all the technology that you want to use to run a smart practice, right? Right from the patient practice, the EMR, then you have, if you're involved in a lot of the data analytics, then definitely you need the population health management, you need telemedicine, you need patient portal, you need AI for decision-making support for providers, right? We are trying to fix the fragmentation in mental health. It's not just mental health, but definitely other illnesses that we taking care, right? So when you have a care team, I know one of the presentation, patient gets overwhelmed. Like, I have psychiatrist, I have therapist, I have primary care physician. How are they going to talk to each other? In a real world, that doesn't happen. I mean, my experience in US, me as a patient to any other, if I get sick or the delivery process, even the floor to floor, they don't have the system to talk to each other. So the history that I gave in triage, I have to give the same history in maybe in the labor room. So right now in healthcare and mental health, we always fishing for a technology which has a seamless integration for existing EMR. This is something that we want. We as a physician, we don't want like build an entire empire. If we have, let's say, 2,000 patients in EMR, we always want to like looking for a technology that has capability to integrate and pull the data, or maybe we have to build up upon these data, what are the next best things that we can do? Medical devices is something that we recently, I mean, in healthcare, I mean, US healthcare, we recently, I wouldn't say recently got the focus, but it was always there. It was always there. What we do is if we have elderly population, we send out the Apple, the iPhone, everything downloaded, shipped to patient's place. What they have to do is just log in, not even log in, just open the app, start the button, maybe like BP apparatus. It's Bluetooth enabled. You take all them, they don't have to record anything. The app actually records everything, and the app sends us all the reading to our EMR. So this integration has helped us a lot, but it's always the technology. It's always the technology which we are sort of like, we have to consider about the data security, cybersecurity, the privacy, and a lot of other things. And so we always tell patients, do not share your password with anyone. If you're sharing, keep changing. If you have a caregiver who wants to, please sign the consent, right? Because we don't want anyone to see the data that from the patient side. Benefits, I think we have the benefits and we have experience through the process. But at the same time, I feel the cost of treatment goes a little up in terms of sending up these devices to patient population when insurance is not the mainstream, right? If they're not, there's always restrictions. They always have XYZ code is not involved, is not payable to the provider, then patient has to pay out of pocket. But as a physician, you definitely want to do something that saves time, cost. You are doing more of the patient remote monitoring, and you're trying to collect a good data on patients. The same benefit we are trying to do for pharmaceutical companies as well. I mentioned about decentralized clinical trial. There's a lot of emphasis on how good quality of remote the medical devices are being used, because we don't want to deal with like error with the data that's been actually captured by these devices and all that stuff. And I think apart from the technology, I think healthcare is a human business. We're dealing with emotions. We're dealing with a lot of thought process and technology. No matter what technology we're using, I feel the doctors and the patients are critical decision making in the whole process, because once you actually train them, then the process gets very easy. I still have the problem, like a few of my colleagues, they still have the problem with adopting the new technology. I definitely feel there's a saturation. There's a saturation for the technology. There's a saturation for the health app that coming in the market. I get, as a CEO of the company, I get like so many emails, everyone selling something. But how that translates into a clinical flow, that is something that we always try, because we don't want to go through the burnout. We don't want to deal with the whole process of like training or rebuilding the whole empire that we have built. So when we onboarding our patients, new patients, we always give them a mini training on the technology so that ease the comfort, takes away the frustration with the technology, irrespective to whatever the age group. I still see that there's a level of anxiety and level of frustration dealing with the technology. And in terms of the provider, definitely it's a big barrier, I would say. They need to feel, the providers need to feel like very comfortable, like at ease to deal with any of the technology. We have AI-based mental health screener that can be put into any of the field where mental health component is not there. So it's a win-win situation. They can do the mental health screening. For example, primary care physicians, they stopped doing the mental health screening in US because insurance doesn't pay. They spend almost 15 minutes to do PHQ-9 and the insurance pay $10. Why would anyone do that, right? So all my physician friends, they actually stopped doing PHQ-9. So there's no depression screening at the primary level. So we built this model where you can do remotely. You don't have to spend your time. You send the link to the patient and insurance pays $50 because you're doing the screening remotely. Patients' experience definitely in terms of technology, I already mentioned that technology impacts the patient-physician interaction. They still feel, oh, when I can see you, doc, in terms of that, can I come to your clinic to get the physical examination done? So definitely few of the disease profile is still is a disadvantage in terms of the patient experience. But in terms of the providing support, I think one of the presentation, creating the whole ecosystem and providing the support and educational material for patient population in an app is wonderful. There's no doubt about it. It's something is better than nothing. And when the focus is more of the preventive, bingo, you nailed it. You nailed it. In terms of the big hospital, definitely the focus of AI and mental health is preventive. So I always see AI and machine learning in only two areas: is the diagnosis, the screening, and the decision-making process. As a physician, we don't want the robots to take away the ability of like the physician giving and deciding what medication goes with your system based on your pharmacogenomics, your family history, your body type, and your the side effect profile, right? So I definitely a lot to learn about what's going to happen with with devices and technology in US healthcare, but always a learning process. And I would say thank you for this opportunity. Learn so much about what's happening at other side of the country, the globe, I would say. And there's so much of learning process in terms of the different health technology that are coming in US market as well. And it's a collaborative approach. It's always a collaborative approach. Thank you so much.
Thank you so much, Roger. Marcelo or Fernando, do you want to add something?
I have a question. We have been seeing a record of investments in mental health, especially in the US.
Oh, yeah.
we are seeing, but as you are a psychiatrist, a healthcare provider, do you see that there is clear advances in the mental health care in the US and globally through digital solutions?
I definitely, there are a lot of investments are happening in mental health space. There's no doubt, but how much that translate into real world, what comes to the patient population, right? That always is a trigger, and that's the driving point for all these companies. I think right now the market is flooded. There are a lot of educational apps out there for mental health, but what is missing is the service, where the providers. There's a study that actually came in, and I think one of the journal, in 2 years, 60% of the psychiatrists are going to retire in US. If that happens, what's going to happen with the population? So that's something that we have to worry. Awareness, training material, I would say, educational materials, everything is fine, but then who's going to treat the patient is a question. Where is the treatment part? Where the doctor? How you increase the access of care? So AI, something that actually takes care. I mean, I know we build this AI for patient to screen quickly, but at the same time takes care of 20 minutes of patient for providers burnout, doing the documentations, right? So it's an entire intake process with PHQ-9, with anxiety scale, as well as mental status examination. So if someone doesn't have the expertise in treating mental health, they can still get a diagnosis. If a patient is mild depression or moderate depression, it's not FDA approved, but I would say it's more of the decision-making support for the providers.
Thank you. Thank you.
Anyone else would like to add up or something or make a question?
Então, bom, Marcelo, acho que a gente já está encerrando, então pode.
All right. So wrapping up, first of all, thank you so much, Rajni, for your contribution and representation. It was very enlightening in terms of understanding about this psychiatric approach and how to use technology to approach it better and make this partnership, let's say, in a lack of better words, between technology and this fantastic moment of being in contact with the patient, physician and patient. So it's very important. So wrapping up, I would like to, on behalf of Fernando and HIHUB, Innova Tech, again, thank you all for sharing your thoughts and sharing your presentations. It was very enlightening. And one aspect for me, it was a very different and complex, and we had different ways of seeing things and approaches and ideas. It was very enlightening, at least for me. So Fernando, thank you for giving me the honor of me being the conductor. And so it's from you, it's with you now.
Okay, thank you so much, Marcelo, Rajni, Gary, Bianca, Marcelo, and Silvana, Fabiana. It was great to have you with us in this panel. Thank you so much that watched us. And I think for us, it's a kind of a stretch making English, but I think we did more than great. And I think this is fundamental for us to connect with other markets and other entrepreneurs and investors can connect with Brazil. So now we are going to our final picture. So, here we go. Please smile, everyone. Thank you so much. Thanks.
Thank you.
Goodbye.
Bye.
Have a good night.
Thank you, bye.
Thank you. Bye-bye.
Thanks, everyone. Thanks so much.
Thank you, Jerry.